but so I didn't take the medicines as much, but I would recommend anyone coming here to not be shy about asking for the medications once the anesthesia wears off, because your comfort is very important here, and the staff makes sure, or they want to make sure that you're comfortable, and you have to work with them to make that happen. And that's something that took me a couple days to learn, is that if you need something, ask for it, and the staff is very accommodating.
So after your recovery, you feel that the staff take care of you very well. How about the level of caring about you after the surgery?
Well, the staff is wonderful. There are multiple nurses here that come in throughout the day and assist you, whether it's bringing you meals, which they bring on a very regular schedule. So you generally know you're going to have breakfast around 9 a.m., you're going to have lunch just before 2 p.m. local time, and dinner around 7 p.m. And they provide you with snacks and water, fresh water, and whatnot. They take care of any suture areas or wounds that you may have, as far as areas that have had surgical intervention, such as the rods associated with the apparatus. They require daily cleaning, and they take care of those, and they clean your room daily. And I was told right away that if I needed anything, to pick up the phone, which is right by your bed, and just call them and let them know what you need. And they do a great job. I try not to bother them with things that I can do myself. But generally speaking, your needs are met. You just have to ask, and the staff is right on the spot when you call, which I thought was really quite amazing how fast they get here when you call, even if it's you need some more water or anything. It's very, very comforting knowing that they take good care of you.
And the question also, the Dr. Veklich comes almost every day to visit you.
That's correct.
With their examination, how the procedure is going. And in your case, there is the slowly correction technique was used, yes, and how you can just let know people about your experience regarding the slowly correction. Was it painful for you because it takes something 7-8 days?
Right. It was uncomfortable at a level that one would expect for a major correction on such large bones. I mean, your legs are, they propel you, and if you're like me, you've been standing on them for many years, and I've never had a broken leg or any issues with my legs, so it was a new experience having them surgically altered, but that's what I was here for. So yes. You have to expect that you're going to endure a certain level of unknown discomfort to have the end result, which is what you came here for, is straight legs or whatever correction that you're seeking at the clinic. So the pain associated with actually the adjustments on the slow correction, you could actually see your legs straightening every day. The doctor would come in twice a day, and Dr. Veklich would talk to you and ask how you're doing. Pavel would be here to translate if needed, and also ask you how you're doing and if there's anything you need. But I was most fascinated by the idea that I had in my mind, was that the adjustments would hurt every day as we're making the slow correction, that they would be rather uncomfortable. But what I found is that the corrections themselves were actually kind of relieving. They relieved pressure. And then over the evening afterwards, then the pressure would rebuild until the following day when another correction would be made. And then, so there was actually less pain at the correction, and then it would ramp back up, and then you would just go through this period. Now I'm, a few days post-correction. I've had my last correction, and my legs are as straight as they're going to be, which they're beautiful. I mean, I'm very happy. It's actually amazing. And my legs, now the pain is subsiding quite nicely. So for 2 days I haven't taken any pain medication. And over the course of my stay here, I took less and less pain medication. But now I'm not on any pain medication for about 48 hours, and I'm sleeping quite well, and doing everything myself. I mean, I just come and go in the room, in the restroom, and the facilities as I please to take care of myself. And if I really need anything that I can't get in my room, the staff helps me.
And looking the slowly correction technology, yes, the Dr.Veklich do the correction on a surgery table, and after that wait for 10 days. The new bone appears in the place of the cut, and after that doing the slow correction during 7-8 days.
Correct.
And once the slowly correction is finished, it is possible for a patient to stand on his legs. So can you explain for patients, future patients, how you feel yourself standing for first time on your legs?
Oh, thank you. One, it was amazing to stand with straight legs, and you can lie in bed with the corrected legs when the correction's finished and see the results, but it's quite different to stand and look down at your legs for the first time, seeing that they're perfectly straight. It was amazing. A little bit of pain associated with the pressure because it's the first time you stood, and by then you've been in bed for a few weeks recovering and having the adjustments. So the only movement that I had for the 3 weeks prior to staying was transitioning from the bed to my wheelchair, and that was a good thing because you get some movement in your knees and some exercise, because it is requires effort to make that transition, which I've been doing for a long time just by myself. So to stand was amazing, and I'm getting better at it every day, of going from the bed to my walker, and I'm doing exercises where I lift my legs and stretch them and move my feet and stretch the muscles, because they get rather tense through the process. So now my strength is coming back and I'm getting more mobile, and so just quite amazing to stand on these legs and try to make progress towards walking unassisted. So that's my goal, is to be walking unassisted as quickly as reasonably expected.
Yes, usually after the first standing, the patient is start walking in 2 weeks.
Great.
With the crutches, and after that in 2 more weeks they start walking without any additional help. So just need time and wait till the moment your recovery will be finished, till you can walk absolutely free. Yes. Looking right now, you are going 1st of December home, yes, and you stay for 2 months at home, and just waiting till the time total healing of your bones, and after that you need to come for the apparatus removal and treatment will be finished.
That's correct.
So the situation is right now you're going home, and could you say to the future patients like some recommendations probably you have to them, what has come to your mind, just like in total, like make like a final words?
Oh, well, thank you. In coming here, I think what I would recommend to someone is to not be apprehensive, to realize that the facilities are modern and clean, and that any notions you might have of traveling to another country, in this case the Ukraine,